Welcome to another episode of I Wonder, Doctor.
As we continue with menopause, I'd like to discuss what makes some of these programs as safe and as effective and, shall I say, most elegant as possible.
Now, I would think that the main job that a person had was to pick the right doctor, right?
Yes, that's what it comes down to.
Yeah.
And yet, at this time in the history of treating women in menopause, I think it's still very important for a woman to know, well, what are the things that really matter, so that she doesn't get surprised in a doctor's visit about these not being conformed to.
Yeah.
So this, to me, begins with the right hormones. And I've already hinted at this, but I want to elaborate on it. Women are resilient for the most part, and almost any hormones will work that are on the market, except prempro. Don't use prempro.
Yeah.
And, knowing what we know nowadays, I would never choose Premarin when these bioidenticals, these identical molecules that are present in the woman's body, are widely available through a pharmacist in your town.
As you said, Premarin comes from a horse, and it's good, but it's not identical to what a woman would produce in her own body.
That's correct. 50% of the estrogens in Premarin have never been seen by a human female.
Yeah.
And it's oral estrogen. And this is to be avoided because we want to make the programs absolutely as safe as possible.
Yeah.
And taking estrogen orally is not the safest way to do it for a lot of reasons that we explain in great technical detail when we train doctors, and also it's in my book.
Yeah.
Now, another thing is, in order to get the best bioidenticals, you need, for example, in the world of estrogen, to choose something called biased. And that means you're going to have to receive this from a compounding pharmacy. These are the kind of pharmacists that are in your town that not only dispense traditional pharmaceutical manufactured medications, they also make up some of their own medications when prescribed to do so.
Yeah.
So they take pure estradiol, for example, and pure estriol, and put it up in a vehicle to be applied to the skin. The vehicle is what carries it, a gel or a cream,
Yeah.
for example. Where are they acquiring this pure estradiol and pure estriol? From the pharmaceutical manufacturers, who long ago realized that they could extract these hormones that are present in plants, and they do so.
Yeah.
So they're producing very pure stuff,
Yeah.
and the compounders are putting it up in the right mixes. Now, the pharmaceutical manufacturers have come into this world of bioidenticals, but they're at the very early stages. And for example, when they're prescribing estrogen, it's usually estradiol in a gel for transdermal application, and yet best information by far is use also an estrogen called estriol, which is the cancer protective estrogen. In fact, 80, 70, 60% of a formulation called biased, estriol plus estradiol, is an optimal way to go in this regard.
Got it. And this is what compounding pharmacists are using, but the pharmaceutical companies haven't yet come around to.
Exactly.
Yeah.
And there's other reasons. The pharmaceutical companies have now gotten into natural micronized bioidentical progesterone. They're not doing it transdermally, which my favorite always in the world of progesterone is transdermal. They're using it orally, which works in the area of progesterone just fine,
Yeah.
but they're putting it up in capsules that have peanut oil in it and have some dyes in there that, to me, this is not necessary. And your compounder's putting up in very pure oils, even
Yeah.
organic oils at times, especially if the prescriber specifies that.
Yeah.
In the world of progesterone, you sure do not want to use something called a progestin. That's what Provera was. Stay away from those entirely. You can get bioidentical micronized progesterone very easily from a compounding pharmacist.
Great.
And then in the world of estrogen and testosterone, transdermal to me is the way to go. I never prescribe estrogen or testosterone by mouth. There's a lot of reasons for that we specify in my book.
Yeah.
And also when we train doctors, we really get into the science. Because what are we trying to do? We're trying to make it as safe as possible. We're trying to reduce the risk as close to zero as we can actually get it.
And using skin rather than the mouth is a far better way to do that.
With estrogen and testosterone.
Yeah.
It avoids so much of the risks that were associated with estrogens
Got
and
it.
testosterone. And then in these transdermals, because these hormones are fat soluble and they don't dissolve very well, 99% of what comes in a jar is actually the carrier gel or cream.
Yeah.
And in order to get those up in a solution, they have to use solvents. And these solvents are problematic. They're not state-of-the-art. This is the safest. So we're proponents and have developed these organic oils, which the hormones, you have to shake the bottle because they're not in actual solution because there's no solvents to dissolve them, but there's no big deal shaking the bottle.
Yeah.
And there you go, right hormones. We elaborate on this again, but I wanted to give you an introduction to it.
Great. Thanks.